Good morning, everybody, and a very warm welcome to our neuropsychology webinar this morning. This is the first of a three-part series focusing on different aspects of paediatric neuropsychology. And today we're looking at the psychological impact of poor sleep hygiene. The series has been put together by our National Children's Serious Injury Group, and this piece accompanies our paediatric conference, which took place last week. It was great to have so many people joining us for that event, and if anybody is interested in picking up on the recordings and finding out what was discussed, there will be a document produced and sent as an accompaniment to the webinar this morning later in the month. So I'm really delighted to be able to introduce our speaker this morning, Vicki Dawson, CEO of the Sleep Charity, formerly the Children's Sleep Charity. I know that Vicki will be well known to many of you, particularly those of you who work in the South Yorkshire and wider Yorkshire area, because that's where Vicki and her team have really pioneered sleep services for a number of years. Over the last 15 months, unsurprisingly, Vicki and the team have been inundated with requests for more information, more guidance about how to manage sleep problems and sleep disorders, as the impact of COVID has really brought sleep as an issue into very sharp focus. So I'm really delighted to have Vicki here with us today, and I will be handing over to her very, very soon. Just a couple of points of housekeeping before Vicki gets started with the main presentation. Throughout the morning, you will have the opportunity to pose questions to Vicki using the Q&A function, which you should find to the right-hand side of your screens. You won't be able to see the Q&A. That will be private. It will come through to myself and my colleagues who are helping out behind the scenes. If you do want to have a more detailed or a personalised response to any questions, please do make sure that you include your name and an email address so that we can follow that up with you after the event. There will be an opportunity to look at those questions both midway through this morning's presentation and at the end. And there is an additional opportunity to discuss some of the key topics, some of those really meaty subjects that perhaps we want to spend a little bit more time going through in our breakout session, which will be taking place at 12 noon. You will find a link to the breakout session appearing on your screen later on this morning, and I will alert you when that post goes live. So without further ado, I'm going to hand you over to Vicki, and I will catch up with you all at the end. Thanks very much.
Thanks, Carmel, and thank you. It's great to be here. So I'm going to be introducing the work of the charity today, and if we could just move through to the next slide, please. I'll just give you an overview of what we're going to be covering. So like Carmel said, we will be exploring sort of the impact of sleep issues on children, young people and their carers. And we'll also be looking at the importance of good sleep hygiene and the challenges that we face around improving sleep issues, and there are many. And I'll also be talking about some practical evidence-based strategies to address sleep issues that we use. Next slide, please. So I'm just going to start by telling you a little bit about the charity in case you're not aware of our work. So I set the charity up in 2012, and it was, as Carmel said, the Children's Sleep Charity originally. The reason that I set the charity up is because I suffered chronic sleep deprivation when I became a parent, and whilst most parents do, it went on for many years. So I was expecting some sleep issues, but not the number that I had, and not for quite as long as they went on. When I was seeking support, I was really surprised to find that there was very little out there about sleep. And certainly sleep issues led myself into crisis and also my family. So the whole idea about the sleep charity was to try to prevent that from happening. And we are now the sleep charity because what we have sort of discovered, unsurprisingly, is that when we improve children and young people's sleep, we also improve the sleep of parents, carers, the whole household. It has a knock-on effect. We do lots of different things. So we do provide evidence-based sleep information, and we have an expert advisory board who support our work, and we're very keen to make sure that any information that we put out there is of the highest quality. We also deliver training, so we train a lot of professionals, we train people within NHS, we're commissioned to deliver this training, and we also provide support, and I will tell you more about that in a moment. We're involved in national research projects as well, so we still have a lot to learn about sleep, and we're very keen to find out more, and I'll talk about some of the research that's been done on our work too. And campaigning is a really big part of the work that we do. So we actually campaign to try to raise awareness about how important sleep is for our health and for our well-being. And we just managed to get in our manifesto, which was called the Wake Up Call, in March last year before we went into the first lockdown. And this was, again, trying to just raise awareness about getting sleep onto the public health agenda and getting the right support in place for children, families, society in general when they do have a sleep issue. Next slide, please. So just to put it into some context, I'll talk about the way that we approach sleep, and we take a behavioural approach to sleep. So we are not medical experts. My background is in education, certainly not in sort of healthcare and medicine. So it's a behavioural approach, but actually most children's sleep issues do tend to be behavioural rather than medical. And where there is some medical issues, taking a behavioural approach can still be helpful. So when I'm talking about behavioural approach, what I'm referring to is looking at the routines, looking at what happens in order to promote sleep, to promote relaxation, looking how parent carers respond to the sleep issues. And I'll come on to that as we move through. But the way that we work is very much in partnership with the young person, if that's appropriate, or with the family, with the carers. They're at the centre of our work, and we will work with them to assess each case. So we do a real thorough assessment, because you can't actually start to input strategies until you have unpicked what may be causing the sleep issues. And quite often with families, they will say they've tried everything, and what we tend to do with sleep issues is we don't unpick it. So we will try some chamomile tea or a lavender bath, and actually if it's nothing to do with diet or relaxation before bedtime, these things are not necessarily going to help. So the real starting point is a thorough assessment around what potentially could be causing the sleep issues. We do a lot of work about empowering with sleep education. So quite often we've not been taught about sleep in school. So families, children, young people, professionals may not be aware of what actually happens when we sleep, some of the science behind sleep, which I will cover as I go through my presentation. And if we can empower with this knowledge, then the strategies start to make sense. We start to have those moments where families recognise why some of the sleep issues may be occurring and why the strategies are so important. We work together to form a plan, and this is really important because plans have to feel doable. So we want families to have ownership of the plans. We need to listen to their capacity to put a plan in place. What are their goals? What do they feel they can work on right now? And most importantly, we offer support. So after the initial consultation, we put in support where the families can come to us and get tips, get advice, and actually we coach them through it, because it's really difficult work to change sleep issues. And we need to be able to be there and celebrate the successes, and when it doesn't go as well as they hoped, be able to give them some support and input. And the research actually shows that the support is vitally important. We're constantly evaluating what we're doing and reassessing and working through this cycle. The next slide, please. So in terms of the work that we're doing, we are a national charity. We are based in Doncaster, and we've got sleep services which are commissioned by CCGs in Doncaster, Bassetlaw and North Yorkshire at the moment. We've also got a sleep service across Lincolnshire, which is lottery funded. So if families live in any of those areas, they can refer to us and we will be able to offer them support in various different ways. So it may be a full one-to-one support package, it could be a workshop, it could be a drop-in session, depending on the needs of the family. And we do provide the training to professionals as well at varying different levels. So we provide sleep practitioner training so that professionals across the country can embed these one-to-one sleep clinics in their services. We also provide training for schools. Our vision is that there will be a sleep champion in every secondary school in the country. And we also provide training to family support workers to deliver parenting workshops. And there is family training as well. So we have an e-learning platform and families can access that if they have a commissioned sleep service in their area. Recently, we have been working on a piece of theatre to empower families with sleep education. And with the lockdown, that's not been able to tour as was planned. But we have produced, in partnership with Tutti Frutti, which are a theatre company, a radio play, and it is aimed at younger children and their families to try to spread positive messages about sleep. We want children to see the positives around sleep and to educate them about it in the same way that they're educated about things like diet and exercise. During the lockdown, we've seen an increase in sleep issues and we have developed a teen sleep hub. So it is a resource that you can find online and it has been developed in partnership with young people. And there is a free downloadable ebook there that the young people helped us to write and design. And that has had over 35,000 downloads since we launched that in October, which is quite incredible for a small charity like ours. And I think it really does sort of highlight the huge need there is out there for sleep information. And we really are campaigning to try to get that positive message out there about sleep as well. The next slide, please. So in terms of prevalence, I think it's quite difficult to estimate how many children have got sleep issues, and there's various statistics out there. You know, some are saying around 50% of children have a sleep issue. What we do find is that if a child has a special educational need or disability, sleep issues are more prevalent, and there's research suggesting this can come in at over 80% of those youngsters as well. And interestingly, research suggests 40% of the adult population is also affected by sleep. So it's a huge, huge issue across the whole country that we're seeing. The next slide, please. So impact on sleep issues sort of from a psychological point of view is huge on children. We know that it can lower things like the self-esteem. Performance is impaired if we're sleep deprived. And there's also links between obesity and sleep deprivation. And it certainly does have an impact on the way that we look as well. There's been experiments where people have been sleep deprived for a number of days and photographs taken, and there's a clear difference in the way that people actually appear. It's not called beauty sleep for nothing, it would seem. There's also a real strong link around sleep issues and sort of mental health. So we know that anxiety increases in children if they're sleep deprived, and this could have an impact on things like attendance, lateness to school, low mood, and the way that they function when they're in school as well. So it's much harder to retain information if you're sleep deprived. And while we're sleeping, we also consolidate our learning. So it's a real opportunity missed if those young people aren't getting adequate, good quality sleep. The relationship between health is a real complex one. And we know that if a child's having sleep issues, it can impact their mental health. And we also know that if there are mental health issues existing, it's likely to impact on sleep as well. So they're really sort of closely intertwined. And one of the most surprising sort of effects of sleep deprivation in youngsters tends to be hyperactivity. And often this is misinterpreted as a child who just doesn't need much sleep. But actually it can be a real symptom of the fact that they are chronically sleep deprived. And this can result in things like challenging behaviours during the daytime and inability to meet the full potential. The next slide, please. And of course, all this impacts on parents and carers as well. And it does depend on the individual child as to how much this may impact. So often we will see at the charity that if it's a teenager who is able to sort of self-manage, parents and carers may not be impacted on as much, and they may not be aware of the difficulties that the child's having. But if this is a child who needs a great deal of parental care and attention throughout the night, it has huge impacts, and they're very similar impacts to the ones that children experience. This lowering of self-esteem, quite often parents question their parenting ability. They don't share having sleep issues for fear of being judged. It affects their performance at work, at home. It can affect their appearance. And also, you know, it results in low mood. Excuse me, I've got a terrible hay fever today. So just excuse me one moment. And mental health issues too, the cognitive functioning, all the same implications as we see for the children. It can have an impact on a parent's ability to cope. They may become hyperactive, find it really difficult to sleep, even when the child's asleep, because it's this sort of hyper alertness, they're waiting for the next wake up, so they can't switch off themselves. And the safety implications, you know, many of these families are driving and they're chronically sleep deprived. And there is research that shows that actually a sleep deprived driver can have slower reaction times than a driver over the legal alcohol limit. We've had families who have lost their jobs because they've not been able to carry them out safely, or because of their attendance, and a huge negative impact on relationships. We're not at our best when we're sleep deprived. So it has a real sort of knock-on effect all the way through the household. The next slide, please. And like I said, you know, COVID-19 has presented us with all sorts of sleep issues, and youngsters are already highly at risk of developing sleep issues, such as the youngsters who do have an additional need or disability. And quite often these have sort of increased during the last 12 months. We've found that there's been a lack of routine at times, which has meant that often youngsters' sleep patterns have drifted and they've been waking up later, going to bed later. And that may have been okay during lockdown, but when life has returned to some degree of normality, schools have reopened, families have really struggled to get children up in the morning and get into schools. It's really understandable why we've seen this happen. There's been a huge increase in anxiety and social isolation as well, which has had an impact in the amount of screen time being used. And there are sort of research papers that suggest that increasing screen time can impact on sleep because of the blue light emitted from the screens, which may sort of trick our bodies into thinking that it's daytime, and then we don't produce melatonin, which is the sleep hormone, so it's harder to nod off. Aside from that, screens are highly stimulating. Now, youngsters have had limited exercise opportunities, and what we know is that sleep issues don't often just resolve. Something needs to happen to get things improved. They need support to get them back on track. And in some cases, we have heard of youngsters who have actually experienced better sleep during lockdown because they're out of education, some of that stress has been taken away. But again, when education has reopened, the sleep issues have started. So we've certainly been incredibly busy over the last 12 months. Have the next slide, please. So what sort of things are causing the sleep issues? What are the challenges that are sort of faced? And when we do our assessments, it's very, very unlikely it is just one thing. Sleep is such a complex issue, and often there are many sort of areas that we need to explore in order to put a programme in place. So we often see lack of routine or that families believe that they have got a routine, but it may not constitute a good routine. So we do a lot of work around routine. We see a lot of what we call delayed sleep phase. So this is where youngsters are falling asleep later than is probably appropriate, and then are having to get up early, and the consequence is they're not getting enough hours. And this is particularly around youngsters who have a diagnosis of ADHD. So there's some research that suggests that they may not release melatonin until later in the evening. And certainly in the teen years, there are lots of biological changes and shifts, and one of them is around the circadian rhythm. So teenagers tend not to fall asleep until much later and then really struggle to get up in the morning. We see youngsters with irregular sleep schedules, so it may be that they're sort of sleeping in at the weekend and that's disrupting things, or inappropriate napping, so they may nap usually on school transport on the way home, tends to be a favourite one, and then they're not tired when it comes to bedtime. Work with families where there's been trauma, and obviously that is going to have a huge impact, and we need to be very mindful about when we work with other agencies, when we get specialist input, because a behavioural approach to sleep can help children in terms of making them feel secure with these routines, but it's also being mindful about when we need that more specialist support to feed into the programmes. A huge problem that we have a difficulty is parents' capacity to make change. So in order to input a sleep programme, families need to be able to sort of really be consistent for at least 2 weeks, and that's difficult when you're sleep deprived. The anxiety issues, diet, feeding, reflux can all impact things like constipation, toileting. Sensory issues are something that we explore in detail. So a child who has sensory issues during the daytime will have them at night time as well. And we need to be really mindful of what's the environment like for them, what can they hear that we may not be aware of, what can they see, smell, all these factors. And that links into the environmental issues as well. We see lots of children who've got complex needs with these wonderful bedrooms that are highly stimulating and not conducive to sleep. And then of course we've got the youngsters with very complex needs, and it may be around pain management and also around disruption, so hospital admissions, and then having to get children back on track in terms of routine, the environment, and many, many more. There's lots of things that we need to explore. Have the next slide, please. So it can be complex, and we may need a multidisciplinary approach. We're very mindful that we are not healthcare professionals. We've got to be aware as well of things like sleep disorders. So things like obstructive sleep apnea, which is disordered breathing at night time, is more prevalent in youngsters who have sort of diagnosis of things like autism, cerebral palsy, and we're sort of listening for the triggers around this. So we'll ask lots of questions about, is there any snoring? And just because a child snores doesn't mean that they've got obstructive sleep apnea. You know, we're listening for, is there any sort of pauses in the breathing during the night time? Any of the gasping, the sudden sort of snorting, waking up? Do we need to be referring in for specialist support? Children with Down syndrome are particularly at risk of obstructive sleep apnea as well because of the facial structure. And it seems to depend very much on where youngsters live as to sort of the checks that routinely go into exploring this as well. So we do train our practitioners to pick up on it and to signpost into the healthcare service if we are hearing that there may be some signs of things like obstructive sleep apnea. Restless leg syndrome is another one that we quite often see in youngsters who have got quite restricted diets. There is a link between it and iron deficiency, and this is where they find it hard to keep the legs still at night. So one young man actually drew a picture of spiders on his legs to try to communicate what was happening to him at night time, what it felt like. Bruxism is teeth grinding, and rhythmic movement disorder is when a child will sort of rock themselves to sleep or headbang to sleep, and it's complex to treat. It's about keeping youngsters safe, but again, often seen in youngsters where there's a diagnosis of something like autism. We do see children who have nightmares and night terrors, and they often get confused. So nightmares are scary dreams. Night terrors are actually still asleep, but may appear to be awake and may appear to be terrified. And there is a link between the night terrors and sleep deprivation. So we see more of those than you would typically expect in the population because we're working with tired children. And we explore things like possible medical issues and medication because obviously they can have an impact too. And again, we need to take a team around the child approach. And the mental health issues of the parent and carer, and actually what support do they need to be able to continue this piece of work. Can I have the next slide, please? So important things to remember, we need to empower with sleep knowledge before strategies. Consistency is absolutely key and timing's important. We prefer families to self-refer to us so that they are ready to do the piece of work, they want to do the piece of work, and it fits in with the lifestyles, because if we know that there's a hospital admission coming up, it's not a good time to start. Or if we know there's a holiday, a house move, it's not a great time to start. I think a really important message to send out to families is when you change anything around sleep, it may get worse before it gets better. And that's really, really difficult because it's hard enough as it is. But if you send that message out and they're expecting it, we can remind families of this as they try to change the behaviours. So it's the same with any behaviour, you know, it's difficult to change, you've got to absolutely stick at it, and youngsters will resist the changes as well. So we ask for this 2-week period of consistency. I think the most important thing that we probably do at the charity is we offer empathy and we really listen. And quite often families have not had anybody really listen to them about sleep. And it's important that they're given that opportunity because it is just horrific to live with. You know, sleep deprivation is a form of torture and it's used because it's effective. This work takes time. We've got to have professionals who have got the time to be able to input this and to follow it up and to support those families as well. Have the next slide, please. So how effective is it? Well, that depends on the engagement and motivation of the family. This is why we like them to self-refer. And we do need to ensure a thorough assessment and pick up any medical things that might be impacting, because obviously that would limit the success. But on average, our success rate's somewhere around 80 to 90%. And we did a research study with Sheffield Children's Hospital. They've got a superb sleep clinic run by Professor Heather Elphick, and with Sheffield Local Authority. And I've got some slides to show you around that, but these were children who were either looked after or had a diagnosis of ADHD, and sometimes both. And on average, the sleep duration increased by 2.4 hours per night, which is an incredible amount, particularly compared to like the men's trial, which is around melatonin, which came in at around about 15-20 minutes increased sleep duration. So it is highly effective. Can I have the next slide, please? So when we're looking at things like ADHD and sleep, there's a real complex relationship. We know that actually sleep deprivation makes ADHD symptoms worse, like the hyperactivity, the impulsivity, the inattentiveness, and challenging behaviours. We also know that these youngsters are more at risk of primary sleep disorders such as restless leg syndrome, obstructive sleep apnea. So we've got to be mindful around those things. And also it can be really difficult to actually get them to bed. So there can be bedtime refusal issues, difficulties with the families sort of getting sleep hygiene in place and implementing routines. We also know that the medications can have an impact as well on the sleep. So if youngsters are on stimulant medications, that may impact their ability to sleep well at night, and also it can suppress appetite, and then they can be waking early because they're actually hungry. So there's lots and lots of complexities around ADHD and sleep. Have the next slide, please. So the research that we carried out, 39 children completed it in total, and the way that it happened is we trained up staff from Sheffield Local Authority, and they gave the input directly to the families. So referrals came in, and the sleep practitioner called the parents and did an initial assessment, and then a researcher went out and did the baseline assessment. The families could either choose a 3-hour workshop or a one-to-one clinic, and they got a sleep plan from each of those. And following that, they got daily contacts by whichever means they chose, encouragement, and we then sent the researchers out again for the post-evaluation. The next slide, please. We looked at the mood of the child on awakening before using the intervention, and you can see that we have got grumpy, aggressive sort of popping out there. And after the intervention, you can see that actually the children were waking in a much happier, sort of pleasant manner. Still some negatives in there, but that's what we would expect anyway. Have the next slide. Thank you. We also measured impact on parental well-being, and we measured it across things like feeling isolated, stressed, relationship with the child. It improved on every single aspect that was measured following the intervention. The next slide, please. Okay. Just got to pause there.
Yeah, I'm going to let you pause there, Vicki, and grab a drink of water. Whilst we just look at some of the questions that have come in, and probably not surprisingly, given the prevalence of sleep disorders in children that you've already mentioned, we have had some questions referring to the prescribing and use of melatonin. Can you talk a little bit more about that? When is it used? When should it be used? How long should it be used for? What's going on with melatonin?
Yeah, of course, that's fine. Yeah, thanks, Carmel. So melatonin is a prescription drug. Sometimes families don't always understand that. So we have families saying that they thought it was like a natural thing that they were giving the child because our bodies produce it naturally. It is certainly, I would say, overprescribed, and what we want ideally is for families to try behavioural intervention first before we get to prescription melatonin. We do find that we're often brought in to try to reduce melatonin prescribing. The difficulty is once they've had it, families are quite reluctant to give it up. Even if it's not particularly working, they're fearful of not giving it to the child and it becoming even worse. So we would rather take this preventative approach and get in there as early as we can to try to prevent children from going on melatonin. And actually, we're working at the moment on a new research project where we are going to be looking at the effectiveness of our intervention on actually weaning children off melatonin and preventing them from going on it, because it's a really important piece of research that. There is a piece of research published around it from Sheffield, and I will find the link for you and I can share that, because this does use our intervention, and it used a nurse who's based up at the sleep clinic there, and it showed that it is effective in terms of preventing and weaning from melatonin. So it does have its place at times, most certainly. So, you know, some children do not produce enough melatonin. So children who've got visual impairments, for example, particularly at risk, and it is helpful. So it's not that we're anti-melatonin, it's actually that it's often overprescribed and we need to try this first. Sometimes we do ask for a prescription of melatonin when we're working with families. So if their body clocks are sort of very delayed, we may ask for a short-term prescription to move the body clocks back more quickly. But it is that short-term prescription, and it is supposed to be used in the short term. And what we find is that children have often been on it for quite a long time, like many years, and yeah, we still don't fully know what the side effects may be. And if we can manage to improve sleep without using prescription drugs, that would seem to be the best way to move forward. And it's actually led me really nicely into the next section. So I will sort of go through why sleep hygiene matters based on the science. So can I have the next slide, please? So we explain all this to our families, that we have a circadian rhythm, and actually when we wake up in the morning, if we've had a good night's sleep, our battery should be fully recharged. And as we go through the day, our battery becomes depleted. And this is what I refer to as like the sleep drive. So the sleep drive's building up during the day. If you have a nap, that tops your battery up and reduces the sleep drive. So when you get into bed, you're not as tired. So what we need to do is have our battery completely depleted by bedtime, so that actually we are tired when we get into bed and we do need that rest. So if a child's having a nap at the wrong time, they're not going to be able to fall asleep easily because they've not got enough sleep drive. Or if a parent's putting them to bed too early, that sleep drive's not built and it's going to have an impact. Or if they are having long lie-ins at the weekend and not having that consistency, it impacts on the sleep drive. So actually, this is something really important we have to keep in mind. Have the next slide, please. So the next thing that we talk about is that some of us are night owls, some of us are larks, and to some extent that's genetically programmed, and it's the same with our children. So some of us will want to stay up late and then have a lie-in, others are up earlier and want to go to bed earlier. And our body clocks, our circadian rhythm, doesn't run precisely on a 24-hour cycle. So if we allow it to do whatever it likes, it can quite soon start to drift. And we see this with a lot of children who have got additional needs. So there's one research study that found on average it was something like 24 hours, 11 minutes, which doesn't sound too far out. But if you keep adding 11 minutes on, you can see how you can become nocturnal fairly quickly without things in place. So this is why routine's important. It's important so that we build that sleep drive, and that actually we have this set wake up time, set bedtime. So we work out where our sleep window is, how much sleep we need, and it's all individual. So it's no good thinking a 5-year-old that needs this amount of sleep. It's the amount of sleep they need to be able to function well and not be sleep deprived. Okay. And it's about looking at the role of melatonin as well. So light and dark play a really important role around our sleep. So when it's dark, we produce melatonin naturally, and that helps us to feel drowsy. And when it's light, we suppress melatonin. So in the evenings, we want it to be darker, and sometimes we've got to like block the nice sunshine out to help to produce this. And in the mornings, we want in daylight, we're wanting to suppress the melatonin and help us to wake up. So quite often we may use things like light boxes as well, that they use with seasonal affective disorder to wake children up if they are struggling in those mornings. Can I have the next slide, please? We also explain about sleep cycles and the way that we sleep, and you can see here this is a hypnogram. So this shows that we've got 8 hours sleep in this particular night, and it shows the different stages of sleep. And what I wasn't aware of until I sort of started studying sleep is that we dip in and out of these cycles all night, and you can see it looks like this person's woken many times, but actually these are partial wakenings, and we do that and it may be that you don't even remember it, you just roll over and go back to sleep. But if something's changed, you're much more likely to wake up. And quite often with youngsters we change things. We will put them to bed with the landing light on and they'll go to sleep with those conditions, and then they'll partially awake and the landing light's gone off, they're now in complete darkness and they'll fully waken up. Or we do things like drive them around in a car, wait until they're in the deep sleep at the start of the night, carry them to bed, they'll partially awaken and wonder where on earth they are because they're now in bed, and that will cause a full awakening. So this is why consistency is so important, and we'll relate this to families. So, you know, for example, if you are there at the start of the night with your child, let's flip that to if you go to bed with a partner next to you and your partner gets up out of bed when you're in very light sleep, in this N1 sleep, you will wake up and say, where are you going? Just like that child asks a parent who's sort of commando crawling out of the bedroom, where are you going? And they go, I thought they were asleep. Likewise, if you wait until they're a little bit deeper asleep and you escape, it is the same as if a partner was to leave your bed and then what happens, you come through this point of partial awakening and you wake up, they're not there. You may wonder where they are. You can rationalise it as an adult, but a child may then need to seek out the parent because they've disappeared. And actually the parents become a sleep association. They need them in place to sleep. So that's where we have lots of the issues where families are staying at the start of the night and then trying to escape. There's lots more I could talk about around the hypnogram. It's really interesting and families find it fascinating, and they have the light bulb moments at these points and they can see why the issues are starting to occur. Have the next slide, please. So adults can provide their own sleep hygiene. We can think about what we need to sleep well, but our children can't. So we need to be exploring what is in terms of routine. And also we need to be acknowledging that it is really difficult work. You know, it's hard to stick to, and it's more than just routine. We've got to think about all these sensory issues, bedroom environment issues, diet, and lots more. Have the next slide, please. And then just some practical strategies really based on all of that learning. Have the next slide, please. So as I've said, it's really important to have regular sleep patterns 7 days a week. And families will try to put the child to bed later on a Friday and Saturday so they can have a lie-in. Does it work? No. So actually regularity is key. It helps to build this sleep drive. It helps to support the circadian rhythm, as does this 30 minutes of light exposure each morning. Next slide, please. I've already talked about screens. We know they're highly stimulating. They may impact on melatonin, and families often think that they are doing the right thing, so they'll put things like bedtime hour on, think that that's going to help. Not generally a good idea. And they also provide a distraction too. So we'll build an hour's routine that has no screens in them and will help youngsters to relax and to produce as much melatonin naturally as possible. The next slide, please. We also look at food. So sometimes children are genuinely hungry, and this is why they're waking. We look at whether we need to put a supper time snack in, the timing of food. What are they actually eating? You know, is it sugary? Is that what is causing them to be sort of more active at night time? And we produce a sleepy food list, which you can see on our website. Families love it because it's very easy to make this one change. And actually, once they've made one change, then that can sometimes be the catalyst for more. We also think about overnight feedings, like peg feeding may need considering, and actually is that the best time to do it overnight for the child and their sleep and the disruption around feeling full overnight, the noise of the machinery, all those kinds of issues. The next slide, please. And light as well in the bedroom. So actually blackout blinds, blackout curtains. What we want is consistency in terms of light as well. And some of our youngsters are really light sensitive. So the slightest bit of light can cause them to wake. And that might be from a light under the doorway. It may be light coming through the windows. It's really important it's consistent. Now, some children do need light in the room, and night lights are fine, but they need to be left on consistently and safely. So, for example, children who have got a hearing or visual impairment can often find total darkness really sort of confusing and disorientating. So having a night light in there can really help. It can also help in terms of things like changing, giving medication. So you're not having to change the light levels constantly, just that low light level coming in. Have the next slide, please. A bedroom environment, you know, we've all got different preferences around what is comfortable, and sometimes families with the best will in the world put things in place they think is comfortable, and then we find youngsters, for example, sleeping on the floor because they want that hard surface, that feedback. So thinking about what does the child feel comfortable, what about noise levels? So if we've got a noise sensitive child, then they may need some white noise running throughout the night to mask out background noise that you or I may not even hear or be aware of. Thinking about not having it overstimulating. Is the bed mattress comfortable? One young man I worked with, his parents had got him a new bed because he'd grown, and that's when the sleep issues started. And some unpicking of it led me to find that he'd been in a cabin bed before that. And the reason they got rid of it is because it was all bent at the bottom. Well, actually, he was getting sensory feedback through his feet, pushing against it. All we needed to do was move the bed so he got something to push against on the wall. That helped him to calm and to fall asleep. And of course, things like room sharing with siblings can often be a challenge when we're looking at sleep programs. Go to the next slide, please. Temperature's key as well. So if it's too warm, it's harder to sleep. So it's best to have a cooler environment around about 16 to 18 degrees. And our body temperature falls during the night as well. So for some youngsters, it can be that they're waking because actually they're getting too cold. So we've got to think about how we can keep them consistently at the right temperature all the way through the night. And there is sort of breathable bedding out there now and nightwear, and looking at breathable mattress protection too, because quite often children get sweaty in bed and it can be hard for them to regulate their own body temperature. And there is a link as well between things like sleepwalking and night terrors and increased temperature too. So really important that they're in the right sort of bedroom environment temperature. The next slide, thanks. And that sort of concludes my sort of webinar this morning, but I'm really happy to take any questions if there are any, Carmel.
Thank you ever so much, Vicky. Really great presentation, and I know that you've given us a whistle-stop tour through lots of different aspects that affect children's sleep and therefore family sleep. We have had a few questions come in and a few comments picking up on some of the details that you have looked at in your presentation. Can you just talk to us a little bit more about some of those issues for children who do have visual or hearing impairments? They may have glasses, hearing aids, cochlear implants that they're using during the day, and then they get removed, taken off, switched off, taken off during the night. What's happening there for the child?
Yeah, I can. And actually, interestingly, this was one of the problems that my son had that I was completely unaware of. So he has got sort of visual problems, and if you read all the textbook stuff, everything says darkened rooms, blackout blinds. So I was doing all that, you know, as I thought was great practice. But actually, I mean, he's 20 now, and he can obviously put his own sleep conditions in place, but he will say when he's not got his glasses on and he wakes up, it's quite scary. He needs to put them on straight away because he's very disorientated, and having just a bit of light coming in enables him to orientate himself in that bedroom and to feel more secure. And certainly this has been the case with other youngsters that we've worked with who've had like hearing impairments or visual impairments, that actually, you know, you've taken that sense away, and that can be very confusing, very scary for them. And in order to sleep well, we need to feel safe and secure. You know, that is one of these are conditions that we have to have in place. So if we've got a very soft light in the room so that we can see around the room, orientate where we are, that is going to be really helpful for some of these youngsters. Okay.
Thank you for that, Vicky. And another question has come in. You talked briefly about the parent becoming the sleep association for a child. What are the other common sleep associations, those kind of, you know, potentially bad habits that might form in families where they think they're doing the, you know, the right thing for all the right reasons?
Yeah, so common ones that we see are feeding to sleep. And, you know, I'm not talking about infants, I'm talking about this can be going on like 4, 5, 6 years old. So actually the child may be using the mum or the bottle as a comforter rather than for the feed, but they develop a sleep association with actually feeding and then going to sleep. And that can be quite a tricky one to break as well, and particularly if it's like breastfeeding and families want to continue with that. So it's about breaking the association with falling asleep at the breast and sleep. So it'll be doing it at a different time, essentially. You don't have to stop doing it. Other common ones that we see are things like lullaby shows. So it'll be a product that usually promises families a wonderful night's sleep. And what we find is that it goes into the bed with the child, it plays a sound, there's often lights involved, and it switches off after maybe 10, 15 minutes. And families think, oh, great, it's sorted it, it's helped them go to sleep. And then what they're not recognising is when they come to a point of partial awakening, the condition's disappeared, so the child then needs attention, and the parent goes back in, puts the product back on, and they go back to sleep. So then the parent leaves these 5-star reviews everywhere going, it's a great product, it really helps them to go to sleep. They've not actually associated it's the product and the dependency on it that is causing the awakening. So we do see that an awful lot. Other sleep associations, things like falling to sleep with a TV on and then it being switched off. And if you relate that to yourself, you know, if someone switches it off when you're in that light sleep, you generally wake up and say, I was watching that. But if they turn it off when you're in that deeper sleep, you probably won't wake until later, and then you'll wake and be like, oh, I must have nodded off. And again, you can rationalise it, but if a child's got used to going to sleep with some sound in the background and some light on, it will be disruptive. Things like dummies are another one, or if they've got a favourite sort of teddy that drops out the bed and then it's gone and they can't get it back for themselves. So any sort of change like that. And I always explain it around families and their own sleep associations. We've all generally got them. It might be you need 2 pillows, or a common one seems to be, you know, needs to be covered up even if it's really warm. And actually, if that's how you go to sleep, and then I interfere with that sleep association, take things away, it's going to cause you to have a disrupted sleep. So we just need to start thinking about it from the child's point of view.
Thank you. One last point before we go to our breakout room. Many of our colleagues who are joining us today will be working with children who have experienced trauma and may have had long periods of time in hospital or continuing to be in and out of hospital. And when they go home, parents then report, you know, huge problems with sleep disruption and waking through the night. Can you talk a little bit about that for us?
Yeah, I mean, any kind of change can impact on our sleep. So, you know, anything like hospital admission, trauma, anything like that, it's going to have an impact. So I think to some extent it's about normalizing it. So we would expect that to happen. And sometimes it happens for horrible reasons like illness, etc. Sometimes it happens for fun reasons like holidays, or Christmas is another one where we get a lot of disruption. So I think a lot of it is normalising it and acknowledging it, and sometimes planning for it, so expecting that it's going to happen. But what we can also do is get things back on track. So if we know that, for example, there is going to be a hospital admission, then actually when they come home, it's getting back into that routine as quickly as we can. We do a lot of reassuring parents that you've got the tools in your toolbox now. You need to just use them when things go wrong. And this is where the empowering with knowledge comes in really, really helpful, because it's understanding that, yeah, when things are different, all of our sleep routines become disturbed. Let's look at the pandemic. You know, most people have had very different sleep experiences during the last 12 months because it has been different. So the key thing is getting back on track as soon as we can, and actually acknowledging that this is normal. It's normal that sleep would have gone wrong at this point because there's been trauma, because there's been hospital admission, because you've been on holiday and room sharing, and now you've got to go back to not room sharing, etc. And I think being able to just talk about it is helpful in itself, without that judgment. I think families are just so scared of talking about it, to be quite honest, and I was as a parent, because you do feel like it's your parenting that you're doing something wrong. But if you don't have the background information that you need to be able to understand what's happening, then I always say to families, did you do the best that you could at that moment in time for your child based on the information that you had? And I'm like, yeah. I was like, there we go then. You know, it's hard work parenting, particularly children with complex needs, and you know, families are doing the best, and it's listening and empathizing and giving them high quality information that they can apply and use throughout life.
That's, yeah, fabulous advice, and a really good place for us to just pause for a moment. We have had a number of other questions come through which are on a similar theme, really, which is about those children who do have more complex needs, who may require medication, treatment, feeding, night carers, all of those things. And I think that that would probably be a really good starting point for our discussions in our breakout room, which is going to begin in just a few minutes. So please, if you are interested in finding out more about those more complex issues, please do join us for the breakout room. You will find appearing on your screen very, very soon a link to the MS Teams room, which we will be hosting for that extended Q&A, and you will just be able to click and follow the link there. So that brings us to a bit of a conclusion for now. Vicki, thank you so much for all of your input this morning, and thank you for taking the time to join us. You've got about 2 minutes in which to breathe, grab a glass of water before you join us in the breakout room. Before I say goodbye today, just wanted to remind people that if they are interested in finding out more about what's coming up in the Owen Mitchell webinars, you can use the owenmitchell.com website and follow the link. There it goes. It appears on the screen now as if by magic. Follow the link to our events programme. At the bottom of that page, you will also find a link to our archive material. So if you've missed anything, you'll find it there. No, I need to cough. Hay fever all around today, I think, Vicki. Excuse me. So just a final reminder about the other 2 webinars in this paediatric neuropsychology series. Next week, on the 30th of June, we will be looking at issues around consent. This is a topic which is raised by colleagues time and time again, something which is a difficult conversation point to have with parents and carers, something which has numerous aspects of the law to consider as well, and we will have the opportunity to talk about that and the test cases in more detail during the session next week. So please do register for that if you haven't done so already. And the following week, on the 7th of July, will be the 3rd in the series, which looks specifically at the differences between a young person with an acquired brain injury and what might be considered normal teenage behaviour. And I know that that will be of great interest to many of you as well this morning. So again, please do take the time to register for that. My thanks again for Vicki. For joining us this morning, and my thanks to my colleagues behind the scene, Teas and Becky, who have been providing all of the technical support. I will be joining you shortly in the breakout room, but for now, have a very good day. Thank you.